You have 5 senses. So when you see an event, like a burning building, then you're able to see it and hear it, and if you're foolish enough to reach out and touch it, then you get tactile information from your skin and also a sense of heat. However, these 5 senses are not really separate. Their sense organs are all separate. We've got the different sense organs, the vision and the ears and so forth, but they interact. What you're interested in is not the actual vision that's coming into your eyes or the sound waves that are coming into your ears, but the external events that they're telling you all about. And that means that the senses have to interact. What you hear influences what you see influences what you hear. They are an interactive system that tells you about external events in the outside world. So how are we going to get all these senses working together? You need a reference point, something that acts as a reference to which you can refer all the different sensory information that you're receiving. What could provide that reference point? The world. We're here on the Earth, and it's the Earth that provides the reference that we're able to use to interpret our sensory information. We're all pulled onto the Earth by the sense of gravity, and that gives us our sense of orientation from which all our other senses can be referenced. When you're looking at a scene, you're looking at it from your body. And your eyes, being part of your body, are at a certain height above the ground, and that gives you a particular perception of the world. When your eye height is different for some reason, for example for a cat, then the world is going to look very different because it's being seen from a different body with different properties, in particular, in this case, different eye heights. So, when you're seeing on your retina some scene like this, there's no information in the visual image itself that tells you what it is. It's just a series of pixelated points of light and dark, different colours and so forth, and your brain has to interpret that in order to be able to see trees and paths and those sorts of things that are present there. So how do you know to interpret this? You have to bring information to the scene. So you have to know where your eye height is in order to interpret it, and in this particular image, you'd have to know what your orientation is. That information is not present in the image. It's something that you have to work out from other sensory information. So how do you know what your orientation is in the world? Well, you get some contact where you're standing on the ground, or if you're sitting in a chair. So as you're all sitting in chairs at the moment, you're getting contact information from your behind, sitting on the chair, that tells you that you're sitting down and that you have a particular orientation. You also have information coming from your ears, not the hearing part of your ears, but a part of the ear that's called the vestibular system that's sensitive to the force of gravity. So if we look inside your ears, we'd see a part of the ear structure that's the cochlea, that little curly thing there. That's the hearing part of the ear. But there's a whole other structure in there called the vestibular system that is sensitive to gravity and provides some important information about your orientation in the world. A system that grounds you, that tells you what your orientation is and the fact that you're in a world environment. So everything depends on your body. But how do you know that it's your body? Well, you can look at your hand, for example, as you're moving around, and as you move your finger, you can see that the finger's responding as you make your movement. You can do it all now. Or hold out your hands, move your fingers backwards and forwards. There's no doubt that that is your finger because it's responding to the commands that you're sending to it. But we psychologists can mess with this sort of thing. So instead of looking directly at your finger, we can make you look at the system on a screen. And then we can add a delay so that you're looking at a live video of your finger, but we can add a delay into that and ask people if they're able to detect the delay. When you're looking at your own hand, you're really good at this. You can detect a delay of about 100 milliseconds, that's about 1/10 of a second. And if it's more than that, then you clearly are aware that your hand is being altered in some way and this delay is present. If, on the other hand, we do exactly the same thing, but with the hand in a different orientation, so now it looks as if it's somebody else's hand pointing towards you, now you're not so good. Now you take an extra few milliseconds, significantly longer, in order to be able to detect that there's a delay in the image, even though it's exactly the same image, except inverted. So, how do you know what that is doing? We have the reference system of gravity, the vestibular system. How's that playing into your ability to identify your own body? Well, again, we're able to mess with it. So we can put electrodes on behind the ears and pass a small amount of current, just from a battery, and put a signal in that disrupts your vestibular signal. Then we can go back and make these same hand movements and ask people to detect the delay again, and they get worse. Now there's no advantage from looking at it from your normal point of view. The time that you need to have in order to detect the delay is now back to how it was when you look at somebody else's hand. You've lost that self-advantage that you get from looking at your own hand. So that's important information to tell us that the vestibular system is involved in the definition of our own body. Well, how else can we disrupt the vestibular system? Deep underneath Vary Hall here at York University, we have a special room. And this room is able to rotate around to different orientations, so that we can have a person sitting in the room and rotate the whole thing with the person as well, so that they're lying on their backs. This means that gravity is no longer acting along the axis that it normally acts. So it's as if we've taken away gravity, at least from the normal direction that it works in. When we do this, we find that people's perception of how far things are away from them gets shorter. Things seem to be closer than they really are when you're lying on your back and the vestibular system has been temporarily deactivated from providing its normal reference signal. Another way that I've investigated the role of the vestibular system in perception is to take it away literally by going up into space. By doing some experiments on the International Space Station, we've been able to look at people's sense of orientation in the absence of vestibular stimulation from gravity, because gravity is not a significant factor in the space station. When we do that, we find that astronauts returning from our experiments and coming back down to Earth, even several months later, have a change in the way that they process their visual information and sensory information to tell them about their sense of orientation. They pay less attention to vision after their space experience. So all these things combine together to tell us that the vestibular system is an important aspect of a reference that tells us about our senses. The senses do not work on their own. They exist only in terms of interactions between them. So the chapters in your textbook, labelled vision and hearing and so forth, are misleading. And the vestibular signal, which probably doesn't even get a chapter in your textbook, is of fundamental importance in binding them all together, giving you a sense of reference from which you can interpret your sensory information, and giving you a more firm interpretation of your own body and of yourself. Thank you.